let's start with a reality check. Where are we in this crisis, and what should Nashvillians expect in the days and weeks ahead?
Well, Phil, I think we're in the early days, most likely. With a quicker response, we hope to limit the time that we will be in this socially distanced period. But almost certainly we're in the early days. The state now has given guidance about school not resuming until the end of April. So in fact, April is clearly going to probably be a month where social distancing will be required. So now we're only really 1 week or 10 days into it in what will be several weeks, but we hope to limit it to weeks and not months. Now that's the important thing for your viewers to understand. The better we socially distance, the quicker we can come out of this.
In 2 weeks, do you think we'll be looking at hospitals that are overflowing with patients?
Well, I hope not. It's one of the reasons why we acted more quickly, was to flatten the curve, to reduce the load on hospitals, and also, frankly, to prepare if our hospitals were more heavily used. Right now, there's a ton of capacity there, and they've done a great job. We do not really have that many people hospitalized now, but we are prepared for worst case scenarios, as we should be.
What is your biggest concern right now?
Well, getting the assessment centers up and running. My biggest single concern, frankly, is that we don't do social distancing effectively, that people elect on their own to violate social distancing, and it just drags out the experience from weeks, then conceivably into months. Where distancing has been effectively deployed around the country, it has made a huge difference. And I hope we look back on this and saying, wow, it was not as bad as we thought it was going to be or could be. Fantastic. That is success in this scenario.
So when you decided to call for safer at home, what convinced you that that was the right thing to do?
Well, in particular, Vanderbilt. They have the scientific expertise, and frankly, they're our biggest health partner in caring for the disease here in Nashville. They were concerned about capacities if we did not flatten the curve. Now, this extra time is allowing us to build more capacity, which we're trying to do rapidly, and to slow down the incidence of our healthcare system potentially being overwhelmed. We do not want to be Italy. We do not want to have an overwhelmed health system. We value all people in Nashville and in Tennessee, and we are doing everything we can for the best health outcomes for everybody.
But it's also going to be devastating for the Nashville economy.
Tremendously. It's a terrible choice to make. But I think if we are effective at social distancing, we'll look back and go, we had a terrible month. We might have had 2 terrible months, but we did the right thing and saved lives.
As you pointed out when you were running for mayor, Nashville has a lot of debt. Can we keep the machinery of government running? Are you worried about defaulting on some of that debt?
Of course I'm worried. And of course we're going to respond effectively. It is the full challenge, I will say. Nashville, as everybody is aware, did not have enough cash. We had the lowest cash of any large city in America. We had the most debt. We were treating non-recurring revenue as recurring revenue, and that has to be replaced. That sounds a little bit technical, but it just means you got a great big budget problem. And then who knew that we would have 2 of the 4 biggest disasters in Nashville history in the last month, right? So all this is a huge challenge, but we are up to it, and we are committed to serving the city and getting to the other side of this, a stronger city. Now, in the meantime, we need a good federal response, frankly, that we're waiting on. That's both the amount of money and timetable. But we are not going to flinch from our role as a city, which is both the first line responder and the last resort responder. If nobody else does it, the city does it. And now we're going to scramble for resources to get that done, but we're not shying away from our responsibility there. And we're going to get it done. And we've had big challenges before, both as a country and as a city, and we're going to do it one more time.
Do we have a cash flow problem right now?
Well, we don't have a cash problem right now because all the property taxes came in February. I mean, we're down to the point of let's acknowledge 2 blessings. it's hard to say blessings in the current environment. One is that the tornado preceded the virus. If you had the virus, you would have had a much more difficult tornado response. And then secondly, frankly, in the fiscal year, this is the period of time where Metro has the most cash because the February property tax payments came in. So we don't right now, but we're going to have to get through the next period of time effectively. And that is, frankly, I'm excited about getting some federal resources to the city to help us with this. We will have lots of financial pressures. This is by far the worst recession that anybody will have lived through, I believe, in terms of its suddenness. To go from 100 to 15 or 10 so suddenly, that has a direct effect on Nashville. And when we do this again, we're going to remember that sales tax money is non-recurring, really, that you can't count on that. Sales taxes can go away. So that's why cities needed to have larger cash balances. And on the other end of this, we will have financial policies that will be more deeply informed about how a city should be financing itself.